So we discussed the important properties. Now we are going to discuss the pathogenesis and epidemiology. So our first point, it only infects human. There is no animal reservoir. And how it enters into our body, it enters in the body by inhalation of the airborne droplets, and after entering it colonizes the respiratory tract. So there are two possibilities when it enters in our body and colonizes the respiratory tract. Either it will just cause a asymptomatic colonization, means the person will not be infected, just he will remain in a carrier state, or the organism can cause upper respiratory tract infections. It depends upon the host immunity. Okay, so when it enters in our body, it colonizes the respiratory tract. Either it will cause infection or will cause not infection but just a carrier state of the person. Third, they produces an enzyme that is immunoglobulin A protease. Now, what is the function of this enzyme? Any secretory surface in our body is lined by immunoglobulin A. Okay, so these are the basically antibodies from our immune system that protects the secretory surfaces. So let's suppose this is our respiratory tract, and if the organism is coming inside and he wants to colonize the respiratory tract, these antibodies will not allow them to colonize. Hence, they first produce the enzyme immunoglobulin A protease that will degrade these antibodies, and when these antibodies will be degraded, they will be able to colonize this respiratory tract. So, this is the importance of secreting the immunoglobulin A protease. Then, if there is an infection of the upper respiratory tract, then these organisms can enter into the blood, and from the blood they can spread to various organs, like they will enter into the meninges and they will cause a meningitis. But usually the meningitis are caused by capsulated bacteria, we have already discussed. Now, in which age group there is a more chances to be infected with Haemophilus? This is the 6 months to 6 years. This is the age in which there is a high incidence of infection, and the peak is at the 6 months to 1 year. So why it is the reason why it is the children are more prone to be infected in this age? Because when the children are having the infection, their immune system is not so much strong to protect them. Why? Because in the children's, their own immune system is not yet so much developed, and their whole immunity is due to their maternal immunoglobulin G. Hence, they are more prone to be infected. So now let's discuss the clinical findings of the infection with Haemophilus influenza. So depending upon what type of infection they cause, I told you there are three main type of infection. They can cause meningitis, upper respiratory tract infections, and pneumonia. So if there is a meningitis, there will be fever, headache, stiff neck, and drowsiness. So there are not so much distinguishing features of the meningitis that caused by Haemophilus influenza, so that we can distinguish it from the meningitis that is caused by other bacteria. There are somehow similar symptoms. And if there is sinusitis and otitis media, there will be pain in the affected area, ossification of infected sinus, and redness with bulging of the tympanic membrane. There are two important causes of the sinusitis and otitis media. One is the pneumococcus and other one is Haemophilus influenza. And third point, which is a very important distinguishing point, is the epiglottitis. I told you that they can also cause a epiglottitis. So what happens in epiglottitis? There will be a swollen cherry red epiglottis. So this is a distinguishing point that you can use to differentiate between the infection that is caused by Haemophilus from the infection that are caused by other bacteria. Okay, so depending upon the infection, there will be the symptoms. Now come to the lab diagnosis. In the lab diagnosis, we use a chocolate agar. Why we use a chocolate agar? The basic difference between blood agar and chocolate agar is the heat. When we heat the blood agar, it converts into the chocolate agar. And why we heat the blood agar? Because in the blood agar, there are some inhibitors that do not allow all organisms to grow. Hence, by heating, we basically inactivate these inhibitors. Secondly, there are two species of Haemophilus. One is Haemophilus influenza and other one is Haemophilus parainfluenza, and both grows on chocolate agar. Then how we distinguish between both species Haemophilus influenza and para-influenza. So this is a distinguishing point. When we want to grow the Haemophilus influenza, we have to add the two additional factors. These are factor number 10 and factor number 5. Factor 10 is a heme and factor 5 is the NAD compound. So if an organism grows with it only on the chocolate agar, then it is Haemophilus para-influenza. If it requires these factors also, then it is Haemophilus influenza. Then other tests that we can use as a diagnostic one are the Coulomb reaction, fluorescent antibody staining, counter immunoelectrophoresis, and latex agglutination test. Now come to the treatment. So again, likewise the clinical findings, the treatment also depends upon what type of infection it causes. So I told you three main type of infections: meningitis, upper respiratory infections, and pneumonia. So if the organism is causing the meningitis or more serious infections like sepsis, then we will use the ceftriaxone. But if it is causing the upper respiratory infection like otitis media, sinusitis, or pneumonia, then we have two combination of drug that can be used. One is the amoxicillin and clavulanate, and other one is trimethoprim and sulfamethoxazole. So depending upon what type of infection it is, we will use that drug combination. Then finally, the last one is a prevention. So in the prevention, we use a conjugate vaccine. What do you mean by conjugate vaccine? In conjugate vaccine, basically we conjugate the type B capsular polysaccharide with diphtheria toxoida carrier protein. And conjugate vaccine is more effective than unconjugate vaccine. Secondly, we can also use a drug that is a rifampin to decrease the transmission and to decrease the carrier rate of persons. Thank you.